President and CEO of Adagio Health. We are thrilled to welcome you to Adagio Health's second Better Health Outcomes speaker series. We started this series last year as a way to maintain connections and to keep conversations about health disparity moving forward. We received so much support from fellow healthcare providers, engaged members of our community, sponsors and partners. We knew it made sense to come back in 2022. For now, we're still virtual, but that may change in a few months, so stay tuned. In the meantime, our plans for this year include today's presentation on health disparities that impact women veterans. We'll look at health disparities that impact members of the LGBTQ community and how health providers and other organizations can create a culture of compassion and greater competency. And next fall, our speakers will focus on health disparities that impact people with disabilities, particularly when there are racial health disparities to contend with as well. Before we get started, I am so pleased to introduce a friend of mine who is a real champion of the Better Health Outcomes speaker series and many other Adagio Health initiatives and special projects. Yvonne Cook is president of the Highmark Foundation, and we are so happy to see you, Yvonne.
Thank you, BJ. Good afternoon, all. I am so pleased to be here as a part of the Adagio Health Better Health Outcomes speaker series. On behalf of the Highmark Foundation, we serve as the presenting sponsor for this year's speaker series. Highmark Foundation is dedicated to improving the health and well-being and quality of life of individuals who reside in the communities served by Highmark and its affiliates. The past 2 years of the COVID-19 pandemic have been so difficult for so many people. This series presents a unique opportunity to reflect on health disparities, both the continuing challenges as well as the solutions as we advocate for better health outcomes together. Women veterans are a unique and often underserved population in Western Pennsylvania. Building capacity and support for organizations that serve women veterans has been a priority of the Highmark Foundation. We are proud to partner with Adagio Health and work together on innovative solutions to meet our community's needs and to support their efforts to provide care and services for women veterans and often vulnerable populations. Thank you for your support of this important series.
Thank you so much, Yvonne. And before we introduce our first speaker, we have a short video we're going to share as Adagio Health employees Liz Heft and Sandy Solosky explain more about Adagio Health's work with women veterans.
I'm Liz Heft, and I'm the Senior Director of Strategic Initiatives at Adagio. Years ago, one of our advisory council members who works at a VA and a local university with women veterans, focused on research, she came to BJ, our CEO. It did get us thinking about the opportunity to work more with women veterans, and that maybe, they wanted a healthcare provider that understood the specific needs of both women and veterans. Maybe they didn't want to receive services out within a military sort of related facility. And so the data that we found about women veterans showed that there are, or were at that time, about 20,000 women veterans in our 23 county region. And about 25% of them wanted to receive healthcare at a women-specific clinic. Most of those had experienced military sexual trauma, or MST, and 50% of those who had experienced MST wanted to go to a women-specific clinic for obvious reasons. And about 70% were estimated to have a mental or behavioral health need that they might want to receive support for.
Hi, I'm Sandy Solosky. I'm the coordinator of strategic initiatives at Adagio Health. I was hired as the coordinator of women veterans programs. The project had to do with outreach for a particular project called I Am Not Invisible. And it was really focused on honoring the women veterans in Western Pennsylvania. And being a veteran myself and nearing retirement age, I thought this could be cool. It was really fun and fulfilling at the same time. And I got to know the needs of younger women veterans. And I really appreciate Adagio's commitment to the women veterans in Western PA.
We see more health disparities among women veterans than nearly any other population, and upwards of 50% of women veterans are in need of some sort of behavioral health service. Many have post-traumatic stress disorder or depression. There's really high rates of substance use disorder, including high rates of tobacco use, and the rate of suicide among women veterans is twice as high as those of, or that of civilian women and male veterans.
So I think what Adagio Health wants for women veterans is that first of all, they feel welcome at all of our services, regardless of their discharge status. That they understand that they are valued and respected at Adagio Health Services, and that when a woman veteran comes to Adagio Health, certainly they will get their needs met for whatever they need, whether it's medical services or food or the WIC program or cancer screening, but that they will also have the opportunity to talk with someone about their own needs in terms of social determinants of health, and that our patient navigator will partner with them to connect them with the services that they need for better health or to improve their living situation, that they will have someone to help them connect with the community, which, all the studies say that women who are being separated from the military need community, a community network of support.
And now it is my pleasure to introduce our first speaker today. Ariana Wagner is the co-founder and COO of the nonprofit organization RISE, Rank and File. She also serves as director in the Office of Veterans Services at the University of Pittsburgh. Ariana is an Iraq War veteran. She is an outspoken advocate for veterans and vulnerable people. In 2020, she organized a protest called Vets for Black Lives Matter in downtown Pittsburgh. She was also featured in Adagio Health's 2019 project for women veterans called I Am Not Invisible. And she is a person we are so glad to know and to work with. Welcome, Ariana. Thank you so much for being here.
Thank you so much, BJ. It was funny to see my picture in the reel with Liz and Sandy, but it's so wonderful to be a part of this Better Health Outcomes for Women Veterans and to be invited. I enlisted in the Army 2 months after 9/11 happened, and I could have never imagined that 20 years later, I would be joining you all to talk about some of the challenges that women veterans face, and what that looks like today after we've gotten out. For me, I think it's important to share a little bit about my story, about why I joined and how I got to be the director in the Office of Veteran Services here at Pitt, or, working to advance minority veterans through Rise, Rank and File. So I grew up a part of the working poor. My mom was a waitress. My dad was a hotel maintenance worker. So for us, food stamps and free lunch was a way of life, right? That was a part of daily life for us. My mom would sometimes work 3 waitressing jobs just to make ends meet, and still they wouldn't. So the work that Adagio Health does to support and protect families and women who come from similar backgrounds is so incredibly important. I can recall many times growing up where the water would be shut off at home. And, I would have to try and figure out how I was going to brush my teeth that day. So you just take your toothbrush and you throw it in your backpack. And when you got to school, you brushed your teeth in the bathroom. Those were realities as a part of my life as a young person. When Christmas and Thanksgiving would happen, if it weren't for my community, they made sure that we had a turkey and stuffing to celebrate Thanksgiving Day, or that there were presents underneath the Christmas tree that morning. So when 9/11 happened, I felt a call to do more, to be present for my community that had done so much for my family. So I enlisted in the Army. I was 18 years old. I raised my right hand and said that I was going to, I swore to protect my country against all enemies, foreign and domestic. And at that time, I could honestly say I had no idea what that actually meant. But I learned quickly what that meant, because in February of 2003, I did deploy in support of Operation Iraqi Freedom. At 20 years old, getting on that plane, I didn't know what to expect when we got there. But, I did my job. I did what I was called to do. I worked really hard. I volunteered for extra shifts, whatever was needed to be done. While I was deployed, about 3 weeks into my deployment, a non-commissioned officer that was responsible for my unit and responsible for me, he raped me. I was 6,000 miles away from home. I feared for my life, not just because I was in a war zone, but I feared that if I said anything to anyone, what he could potentially do, and no one would know. We were at war. So I didn't report it. I told no one, because I felt that it would not only be my word against his. He as an officer, I as a junior enlisted, who would believe me? There are very few women who were in my unit at the time, and I was one of many. So after that experience for me, I know that I changed. I know that the person that enlisted and raised that hand was no longer the same person. And that trauma made me feel as though my life might be over. And so for me, being resilient, finding those resilient pieces, right? Looking for those bootstraps to pull up. I dealt with my trauma differently than others, right? Everybody who experiences trauma deals with them in different ways. So for me, I focused on all the things that I wanted to do. I added so many things into my life that I didn't give myself a minute to breathe, that I didn't give myself a minute to think. So that meant when I returned home from deployment, I eventually got out very shortly thereafter. I had an honorable discharge, and we'll talk about discharge status. Liz mentioned it in her remarks earlier. I had an honorable discharge. I got out, I met and married. I had 2 children. I worked full time. I went to school full time. I earned a bachelor's degree and 2 master's degrees, and then went on to have 2 more kids, and went on to run for United States Congress in 2012. And I ran for lieutenant governor in 2017. And I just kept going, right? I just kept doing, I just kept ignoring. I just kept pushing it down, because one of the things you learn in the military is how not to feel, right? We learn how not to feel. We don't learn how to deal with those feelings. We go, oop, they don't exist, and push them down. So that's exactly what I did. And unfortunately for me, I started to, at some point, right, break down. I started to see that those feelings and emotions would come out, and they come out in ways that were surprising to me. I get angry. I get upset. I didn't know how to show empathy for my own children at this point, right? I didn't know how to fix it either. And so for me, I recognized in that moment that I had to do more. 1 in 3 women who serve in the armed forces experience MST. 1 in 3. 1 in 50 men also have the same experience. And MST is something that encompasses everything from but everything from sexual harassment to assault. I call it friendly fire, when you attack those who are supposed to be on your side. Maybe a better term would actually be collateral damage, because it's intentional. Women are less likely to report this abuse for similar reasons as to why I chose not to report. If their assailant, like mine, was in their unit, then you also potentially lose that in community that you so necessarily need while you're in the military. So for those that don't know, when you serve in the military, you live where you work and you work where you live. Your friend group is often that community member of people in your unit. So if you're assaulted by someone in your unit and you report it, there's a high likelihood that you're now going to be labeled as making waves. And you may lose friendships with others. You may lose those connections to your community. And so people don't say anything. They don't report. You may feel as though you would be retaliated against, right? And so unlike a civilian job where you can just quit and you go, forget it, I'm out. You can't do that in the military. If you do that in the military, that could impact that discharge status, right? And there are a number of discharge statuses, but if you are caught using drugs or alcohol in a poor way, maybe not so much alcohol unless you are doing something that's illegal because of that alcohol use, you could potentially get a other than honorable or a dishonorable discharge. And that discharge status, when you leave the military, now can impact the type of education benefits that you receive. It can impact your access to healthcare, and it can impact your access to nonprofit organizations who support veterans here at home. And so we do see a lot of those folks who experience MST in the military receiving discharge statuses that are other than honorable. 40% of women who are homeless, women veterans who are homeless, were subjected to MST while in the military. And that can be a relationship as to why they are homeless, the untreated PTSD from that experience, the struggles with drug and alcohol to cope. So these are all compounding problems that stem from military sexual trauma. And so then now we're out, right? We know we've had these experiences, but now we need help. And I can remember, 15 years later when I decided to get help, that I didn't really know how to start or where to go. As a woman of color, my father is Black, my mother is white. So when I started down this path of recovery, I wanted to start with therapy. I wanted to start with a therapist who took the time to understand my trauma, who took the time to understand my lived experience. But access to mental health care for women veterans. We heard some of the statistics earlier. 25, I think it was 70% of women need support in behavioral health, women veterans. So with that, that access to care can be a really big barrier. We have local vet centers here in the Pittsburgh region, one in White Oak, one in the Green Tree area, but their staffs aren't equipped to support women veterans, survivors of MST, even though that's part of their mission. They have, I think, maybe one woman on staff. She's certainly not a woman of color. There are probably, there's no one that I could go to that I feel like understood me, that would understand my experience. I want to talk to a woman. I want to talk to a woman of color because she's going to understand all of the different facets of my trauma. And outside of just that, the others on staff, you have to be, qualified to treat MST. And, they have combat trauma experience, but MST is a very different type of PTSD that we experience. So, okay, so maybe the vet centers are out for me and maybe I can head over to the big VA on the top of the hill. Well, unfortunately, their prescribed PTSD mental health care treatment is just a few weeks long. I think it's 8 or 9 weeks long. And there's extremely long wait times. So the access to care means that you're not going to see a therapist on a weekly basis. And it limits our ability to receive treatment. So all of this to say is that if we really want to start truly supporting women and quickly, we need to open up the VA's community care options for mental health. We need to start advocating for mental health treatment outside of the VA, utilizing community care for survivors of MST, both men and women alike. When I got out, I just wanted to get out. I did not want to be a part of the military community. I didn't want to tell people that I served. I remember going to the VA to get healthcare and attempting to enroll and get my ID. And here I was, 22 years old. And I kept getting pushed to the dependent side of care. I had to explain that I was the veteran, that I served in war, that this what ID was for me. This was for me to access care here. Even today, when I walk into the VA, I'm asked, "Oh, are you here for a meeting?" No, I'm not here for a meeting. I'm here for an appointment. I'm the veteran. And so it can be frustrating even today as a woman veteran. I had an appointment a couple of weeks ago. And my care provider said to me at the end of our session, end of my doctor's appointment, it was really nice to talk to a young, healthy woman. I don't see many of you in here. So, women aren't going to the VA for care because you're being catcalled as you're walking down the aisle, to your appointment. You're being asked if you're there for a meeting. And so there is a culture that needs to start changing within some of these institutions to make women feel comfortable to access care. And if we can't address that culture issue, then we need to be sending women outside of the VA to get the treatment and the care that they need. Prior to the last year or so, the last time I was in a VA was 15 years ago. But however, I got pregnant and I said, I want to try to have my baby and have the VA help me because I want to know, how does this work? If I'm a young woman ready to have a baby, what can the VA do for me to support my maternity care? Because I know about a decade ago, they didn't have an OBGYN on staff. So I wasn't quite sure how they were going to be able to support me. And I will say this. This is my 4th child. So I've, been through this a couple of times before. But they had not only a lactation consultant, but they had a pelvic floor therapist. I didn't even know what that was. And So she explained to me what her role was. So I was really surprised to see some of the advances in obstetrics and gynecology, though for all of my like having baby, I was able to utilize the community care options and see my own doctor. But the access to supportive services for me, even after delivery, was pretty remarkable. They were able not only to connect me to that lactation consultant and a pelvic floor therapist, but they provided me with a breast pump that was better than the one that my private insurance provided me. And they were able to provide me high quality nursing bras, which are expensive. And the part that I was the most surprised about was that the breast milk storage bags are actually a prescription. I don't have a copay for, but I can fill my prescription and get 50 breast milk storage bags. I think all insurers, all providers should be doing that. That is something that is an expense that's quite significant, but it means that we are still encouraging breastfeeding for our moms and or breast milk for our babies. And I think the VA, that was pretty surprising. I was shocked, to say the least. And it was a really good indicator of, maybe we can be doing something like this within other organizations too. But all of that to say, I never imagined that my time in the military would so profoundly shape who I am as a woman today. After moving here to the Pittsburgh region, I did find that community of veterans. I started to engage in programming with local veteran nonprofits. I started to connect with others who had similar experiences to me. And for the first time in a long time, I didn't feel so alone. I started saying that I'm a veteran. I started participating, getting my picture taken with the I Am Not Invisible campaign that Adagio Health sponsored and was a part of. Like, that was really something I would have never done before. And I will say, when we all came together at the end, pre-COVID, and saw everyone's pictures blown up to what felt like life size, and to have that programming there and see all those women there, it was a remarkable night. But, so connecting to those other women was a really important part of my growth and of my recovery. And through all of that, as I participated in this programming, I started to recognize that there were really big gaps in services for women veterans, for women veterans of color, for LGBTQIA identifying veterans. And we were included, but the programming was really built for the veteran. When you think military veteran and he's 6 foot tall and he's white and he's got a buzz cut, wearing a ball cap that like touted the campaign he served in, right? Like, that's what people think of when they think of a veteran. They don't think of someone who looks like me. So in 2019, I began sharing the stories of veterans who looked more like me or had more experiences that might have been similar to the ones that I had. And that was our podcast called What a Veteran Looks Like. And in 2020, with the help of a local Navy veteran, we decided to expand that podcast into this nonprofit organization where we provide support to minority veterans. We also educate other nonprofits on what and who to include in populations and programming around minority veteran populations. So we began advocating. And through that advocating, we were able to lead the Vets for Black Lives rally here in Pittsburgh. We protested the exclusionary motto at the VA that leaves out women, which is that fastest growing population of women veterans. And we are going to begin advocating for discharge upgrades for survivors of military sexual trauma. So women veterans are impacting our communities every day. They're leading organizations, they're running for office, they're contributing to society in so many important ways. So ensuring that women veterans receive the care they need. Within this discussion around better health outcomes, we can't forget that physical health. We can't forget their mental health. And I just want to say thank you so much to Adagio Health for including women veterans in this conversation and including me today. It's been an absolute honor. Thank you so much.
Thank you, Ariana, for sharing your story, your insights, and your service. Next, I am so pleased to introduce Brigadier General Maureen Weigl. She has served as Deputy Adjutant General for Veterans Affairs in Pennsylvania since 2021. In this position, General Weigl supervises the administration of state veterans programs, reintegration and outreach, and veteran initiatives for nearly 800,000 veterans and their dependents. She retired from the Army in 2016 after serving for 25 years. She started her own woman-owned and service-disabled veteran-owned small business, providing government consulting, talent management, and recruiting services. She is a passionate and dedicated advocate for veterans and their families, and we are so thrilled to have her with us today. General Weigl, thank you for joining us. The floor is yours.
Good afternoon, and thank you so much for having me. It is my pleasure to join this discussion. It is critically important these days, and I'm proud to be talking about women's military service and issues during Women's History Month. On a really positive note, I just want to say that women today are continuing to push so many boundaries. I am the first female Deputy Adjutant General for Veteran Affairs in the state and Commonwealth of Pennsylvania, but I know I will not be the last. And that is because of all the women that have served prior to us since the Revolutionary War. You know, over 300,000 women served in the Iraq and Afghanistan war, and over 9,000 earned combat action badges, which is incredible. We've had a first female Secretary of the Air Force. We've had a first female Vice Chief of the Navy. We've had a first female combatant commander. We've had first female 4-star generals, and we will continue to see so many firsts. But you know, with some of those firsts came a lot of trials and tribulations for so many women that have served in the military. But so many of us have so many positive things to say about our service as well. But I would like to talk about, because women are the fastest growing demographic, there are things that we all need to do to address the challenges and the healthcare requirements for families and women and their children. When I served and started serving back in 1992, only 10% of the population or demographics of the armed forces were military. Today, it's close to 20%. That means as women continue to serve in every branch, in every service, and in every job, we need to make sure when they leave the service, they have the same access to care as their male counterparts. And we are not there. We are wonderfully an organization that does equal pay and equal opportunity today. And that just started in 2015. Now we need to make sure we have equal opportunities to take care of those females. I've been in this position as the Director for Veteran Affairs for Pennsylvania for over a year now. And I have gone to many homeless shelters, many of the organizations that are in our communities taking care of our veterans. And we are short to address the issues that women are having. Many women that leave the service today are still trying to find employment and find help. But sadly, women have a higher percentage of suicide and homeless. And we need to address that issue. There are many shelters available for male counterparts, but because many women leave the service with children, they have a difficult time finding a place to live. And many of them have low income housing. And it's not that they are homeless, it's keeping them into their homes. And that comes with great work at my level with all of our sister departments in the Commonwealth of Pennsylvania and all of our nonprofit agencies. You know, when I served and joined in 1992, I enlisted as a private and I went to basic training. And I probably was one of the most educated women as I was a college student, second year, while I went to basic training that was in my platoon. And I remember receiving so many letters every afternoon from all of my college friends and my huge Irish Catholic family. And I'd be sitting there at mail call after the end of a long day, receiving all of this mail and laughing and just being so excited that my family kept in touch and my friends kept in touch with me. And at night, I could hear women in the bunk beds just bawling their eyes out. At that time in 1992, if you joined and you had dependents, you weren't allowed to enlist. So many of the women had to give up custody of their children so they could enlist. And they did it because they wanted a better life and better benefits for their families. And many of those women did not hear from their family members the entire 8 weeks that we were at basic training. Many of them didn't know if their ex-husbands or their parents were going to give custody back to them. It was truly a struggle. You know, when you become an all-volunteer force and you rely on female services, the military and Department of Defense had to adjust their strategy to ensure that women could serve. So those policies changed year after year. When the first Gulf War came, very quickly, Department of Defense realized we had to adjust our family care plan policies so that women would have documents in place to make sure if they had to deploy and leave their children, that they had someone who can come and pick up their child to take care of them so the female could deploy. There were many dual military families that when one spouse had to go, the other one had to stay back. Department of Defense, again, had to keep being flexible and adjusting policies. And we've learned so much. When my boss, a 4-star general, told me that when he was a young kid, his father was a pilot and he was shot down in Vietnam, and he was a POW for 6 years. Back at that time, they assumed, the military assumed, that you could have been killed, and they cut off the family's benefits. I couldn't imagine that happening today, and it doesn't happen today. We've been evolving since we become an all-volunteer force and opened up more opportunities for women. But being first has its challenges. If you talk to many women who were in their service at times, they were very lonely, did not have a lot of peers. In 1994, I was with the 10th Mountain Division and I deployed to Haiti. I was the only female on a plane of about 300 service members going into Haiti. You had to sit there and deal with people making comments, joking about you, always trying to hit on you. And, you know, you had to just learn how to deal with those unwelcomed and unwanted advances or comments, and you had to sometimes go along. I was a brand new second lieutenant, and sometimes the only thing you can do is act like one of the guys and act like that didn't bother you. And back then, that's how women had to get along. You had to prove to yourself, show that you weren't easily offended, and hang with the guys and be able to tell the same kind of stories and laugh, even if they had no reason to tell you those stories. When I was in 10th Mountain Division, we not only deployed to Haiti, they came back from Bosnia, Somalia. We had a lot of issues on our base at 10th Mountain Division with suicides and issues. What I've noticed at that time as a lieutenant, that female enlisted service members often struggled with more problems with their peers. They had a harder time interacting. They had a harder time fitting in. And a lot of times it was because of their senior NCOs mentality and toughness, and didn't know how to address the females that were serving with them. And that was a real struggle I've seen throughout my career. The differences for officers and enlisted and how they were carrying and how they got through some of those challenges of being one of the females alone in their unit. I would tell all of you, if you're really interested to see what really turned around the Department of Defense's handling of the disparities for women in the military, was the 2011 Invisible War documentary. In that documentary, they highlight topics like military sexual trauma, military assault, military harassment, and the services policies at the time for sexual assault, SAPR and SHARP policies throughout all 4 services. And they showed the problems with the judicial processing of cases. And you would notice that for years, many women were told to leave the service and they were blamed for the assaults or the harassment. And the men were able to get promoted and continue to serve. It was a real issue, and it was highlighted in 2011. And since then, many changes have happened and many things have been put in place. The pendulum went to the other direction, where now they do hold commanders, male and females, responsible for ensuring that the command climate in their units is adequate, and that no one should be afraid to serve and no one should ever experience sexual trauma. Sadly, many women do. I've been in this position and I've hosted numerous sessions with female veterans, and I was very shocked to see the amount of women that have experienced sexual assault, sexual harassment throughout their military career. Sadly, many of them left the service and chose not to continue serving. I stayed in because you couldn't fix it unless you were still in the service, to help the other females and to help the policies and to help your peers understand the right and wrong way, and to treat everyone with dignity and respects in the military values that we were all taught as leaders. And I think today you'll really see a big difference. And I'm so proud that women continue to serve and push the boundaries they're doing. And the first female Ranger probably had a terrible time. The first female fighter pilot had to deal with the same situations. But today, thankfully, women have senior leaders to look up to, and women have policies in place to protect them. And that's a huge difference. So it's encouraging, and I'm very excited that that happened. I know in my military career, there were many times when I felt alone, I felt singled out. At one position I held in, my babies were only a newborn and a 2-month-old or 2-year-old. And when my child was sick and I had to go and take my child back from daycare, my boss wanted me to take an entire day off. Now, when the guys went golfing, they didn't have to take a day off or a half day off. And at this time, we were on a leave and there was no reason why, but he didn't want to look like he was giving me any special treatment. I remember we had a female 2-star come to visit, and normally a lieutenant colonel or colonel would go and pick up the female 2-star who was visiting. And my boss had no time and desire to go meet this female 2-star. Didn't pick her up, shook her hand, and let me, as a captain, walk this wonderful 2-star general pioneer around, and gave her very little respect. And I saw that. And I remember she saw me and I was dropping her off, and she said, you know, you have to stay in. You have to stay in to fix it. She said, don't get upset for me. She said, I've been in and I've been through a lot worse. She said, just don't you give up. And that really meant a lot. The other thing that's really great about my position now is I went to a baseball game last year at the Phillies, and I was being honored, and I was asked to pick up third base. And they announced me as Brigadier General Weigel for the Deputy Adjutant General of Veterans Affairs of Pennsylvania. And I didn't realize how important being a female general was until that moment when I left the field and I started walking up the bleachers. All the females that were sitting down in their seats stood up and came to the end of the aisleway so they could shake my hand and thank me, and then ask me if they can get a picture with a female general. And I was really taken back. And recently I worked on a documentary to update the women in the military videos from 2008 until today. And I interviewed many women, female generals and colonels that, you know, never realized when they were serving and they were female generals that they were the firsts, and they'd never even thought of it as they were just going through your career. You wanted to be a fighter pilot, so you flew. You wanted to serve, so you did. And many times, you know, we didn't step back and say, what are the people underneath us looking at? And what can we do more to inspire them to stay in and to protect them? And I think we've learned a lot, that we've learned that mentorship and female examples and leadership examples are critical to the success and to the future success for all of our female service members. I had a great career. I had a very unique career. I served in the Army National Guard, and the Army Reserves. I started out as a private, and I experienced many things when I was at basic training in AIT and drills from an enlisted point of view. And I saw many disparities, how the female enlisted soldiers were treated so differently than the men by their bosses and their supervisors. And when I became a lieutenant, I didn't want to do that. You did have to deal with harassment at times. You had to deal with the dirty jokes, unwelcomed advances from many senior leaders throughout my career, even when I was married. That happened, and we accepted it. We just thought that's the way you get along. You tell a dirtier joke, and it was wrong, and it shouldn't have been tolerated, and we shouldn't have had to do that. And thankfully today, the females don't have to do that, and we have policies. Is it perfect? No, but they've made great strides to help the military and to help the females. When I was in, let me just go back a little bit, sorry. When I first joined in 1993, I was a second lieutenant, and I was down at Fort Bragg, North Carolina. And I had a roommate who graduated from Princeton University. And my first 2 weeks on active duty, my roommate was shot and killed right outside our hallway. by an NCO who was staying just a few doors down the hallway. They called it a murder, a homicide. He was arrested and is still in jail today, a father of 3. And I just couldn't wrap my arms around it. And I remember when I had to get her uniform ready, all I could think of was the movie Top Gun, when you put everything in a box and then you get their service uniform. And I couldn't believe, it was so surreal that I was living this experience. And she was shot 5 times in the head right outside my door. At that time, I had no idea what I got myself into. And I didn't know why I was going to continue to serve. And I was furious when one of her former cadre from her university came in to get the uniform. And he said, we know she was a little bit of a bitch. And I almost fell off my chair. I wanted to punch him in the face. I wanted to kick him. I was like, she was the most beautiful woman, graduated from Princeton University with honors. And here she is serving, and she had no reason to die this young. And I was furious, and I couldn't believe I had to listen to that. And I'll fast forward it to when I was teaching ROTC at Penn State, and I had to go back out to another advanced camp, but this time as a cadre. And I had to work with cadets, and I was the only female cadre member for this company. And we all had to walk down every morning at 4 a.m. to go wake up our cadets. And we would sit there and we had to evaluate them all day. And we'd leave at midnight and have to walk back to our barracks. Well, I was the only female at that time in this building. And there were no keys except for your little tiny key to walk into your door. And it was terrifying. And after I left where all the male cadre off, I had to walk another half mile alone at midnight. And then again at 3:30 in the morning to get to the cadets. And when I asked if I could have a ride or a car, they told me they didn't want to give me any preferential treatment. And I was like, that's not preferential treatment. You're safeguarding a troop. Like, my life matters too. And they said, nothing's going to happen. Now, I was at Fort Lewis, Washington, where I found out later many things did happen. And I couldn't believe I had to ask for security just to get to a place to sleep at night to go and then take care of troops. And then in 2008, I was in Iraq, and I was doing a project, and I was flying around Iraq and Afghanistan on many aircrafts. And I had a lot of fun doing that, by the way. But I remember the one time I flew into, I want to say it was Talil, and I got there and I asked where my quarters were. And they said, oh, well, the female VIPs are over there. And I was like, oh, well, there doesn't look like there's anybody over there. And they're like, well, no, but that's where the females stay. I was like, well, where's the bathroom? And they pointed about a football field away of where the bathrooms were. And then I looked at where the males were staying. I was like, but we all have single rooms with our own single keys. And they said, yes, you do. They said, but the females have to stay over there. So I went to where that building was with this gentleman, this officer, a peer, another lieutenant colonel. We walked over, and he went to open the door, and that door didn't work, and it was busted. Then he went to the next door, and he went to the next door, and he finally found one. And he looked at me and goes, oh, you'll be fine here. You can sleep in here. And I said, I'm going to ask you 3 questions. The first question, what happened to those other 3 doors and the women that were in those doors? And he didn't know the answer. I said, the second question, would you let your wife or daughter sleep here instead of over there, where she's now more vulnerable, and you're going to leave her out here? He said, oh, you have a 9mm and you have weapons. I was like, and I'm not allowed to be locked and loaded on installation like this in a fob. He's like, you'll be fine. I said, well, my third question is, where's your office? Because I will sleep on your floor. But I couldn't believe that that's the progress we made from when I deployed to Haiti to when my roommate was shot and killed to when I was in, as a cadre, that they still didn't even take serious the fact that there are assaults committed against female servicemen, women every day. And they didn't want to give you the support or the help to protect you. And that always bothered me. And again, the only thing I can tell you is no one should be afraid to serve. And I am confident that today, those policies and procedures and mistakes they made are being addressed, are being changed. And I see so many positive opportunities. Now, the one thing we are working in Pennsylvania is to address female homeless and female health concerns. And the VA has improved drastically over the years. But where we lack is to make sure women have female health concerns addressed. And I still am furious that at many facilities, a female sexual assault victim has to walk through a lobby full of men who still make comments and still stare. And then you have to walk down a hallway that everyone knows is for sexual trauma. So we keep making these women re-stigmatize those situations and those events, and it's unfair. And those are many of the things that we have to still address. And you know, it comes from communicating, from educating, from women talking to us. Sadly, although we are the fastest growing demographics of veterans, many women, because of their experiences, and because we didn't treat them well when they left the service, they do not self-identify, and they don't come to us so we could help them. So I would just encourage female veterans, if you know other female service members, to get them to our facilities, to get them to get the benefits that they earn and that they've deserved, so that we can take care of them and we can address these real needs and these real issues. So, I mean, I just want to say thank you so much for having me. Thank you for tackling this enormously important topic. Again, on a positive note, we've made so much progress. Sadly, there's still so much work to do, but I am very encouraged and I'm very proud of all the first we've done. And I know we're going to continue to push boundaries, and we will take care of our fellow female service members and veterans. Thank you again.
Thank you so much for your service and for your important work, General Weigel. And my thanks to you for joining us today. Our sponsors, our presenting sponsor, the Highmark Foundation, and the entire team at Adagio Health work so hard to achieve better health outcomes in the communities we serve every day. See you next time.